Really? Why are these guys not being sued into the ground? Because they pay a lot of money to get stuff through whatever governmental body, whether that's in the US and the FDA or EDIF or whatever it is. Hey, I'm Dr. Ruth Roberts. So glad you are able to join today. We're going to talk about something a little bit different. I've got some amazing folks that are going to come on in a little bit, a couple of weeks, to talk about Librela in specific, but there is an amazing organization that is trying to make not only pet parents but veterinarians aware of basic things like the fact that the FDA sent out a letter about the most common reactions to Librela and side effects of this. That will be fun. But I do want to give you some information that you can use as we start to approach allergy season. Because the top two drugs in terms of supporting pets with allergies, aside from prednisone, are Apoquel and Cytopoint. And both of them work by manipulating the immune system, right? It's interesting. We used to have a cyclosporine drug, which I forget the trade name of now, but that's not used very commonly anymore because these are safer. So how do you know what's safe, what's not safe? How do you find out about it? So here's the frustrating thing is that it is super duper hard to understand what what is safe, what is not safe, and to get more information. So I'm going to actually just share my entire screen because I think it'll be easier to move through this. I'm going to show you why. So if we go to the FDA's website and I just typed in adverse reactions of vet drugs. So there's some random stuff in here about things that we just can't not miss. So for instance, here's a fact sheet for pet owners and veterinarians about potential adverse effects associated with isoxazolone flea and tick products. And what is that? So you've been seeing people say, "Oh, this class of drugs is yet it is a problem," and basically all of these pills that you give for flea and tick prevention, so Bravecto, NexGard, Credelio, Simparica tablets. So get the trend here. We're giving all this by mouth. And then Revolution, which is a different one, selamectin and sertraline. It's also available for dogs, although that's quit being a problem. So here's the fact sheet. What do you do about this? So if you've seen your pet have a problem, you're supposed to call these guys and rely on them to turn in an adverse drug report, or you can do this yourself. So this is really frustrating because this is difficult for the average pet parent to navigate. I'm going to start dropping some links in here for you because I think it's important for you to have this info. All right. Now, how can you do some research? Also, an inordinate pain in the behind because the data is all shared on JSON files, which is a particular file type. And then, so how do you, the average person, deal with this stuff? It's frustrating. So here's all the reactions over per quarter, and then there you are. So what does that mean? What does that look like? If we look at quarter two, we get this crazy looking file, which is a JSON zip. I don't have a piece of software to read this. Now, if you are like going for it and you're going to pull all of these events, right on, go for it. I'm going to drop this here for you because I think that it's tough to go through there. Here's the other problem. Now, this is NOAA, which is a company that provides data sheets for many different manufacturers. And so here's the one that Cytopoint, that was developed by Zoetis, the manufacturer for this drug. Most of this data is related to what they saw in a clinical trial, and it doesn't assess long term, like I'm talking years of potential side effects. And this is where it gets difficult because many of us have seen things like cancer or autoimmune disease or some other horrific thing develop when one of our pets has been on these medications for years and years. So, evidently, so if we read through this, here's the special. Don't use it in dogs less than 3 kilos, which is 6 pounds. It may produce transient or persistent anti-drug antibodies because this is a medication, a monoclonal. Anytime you see MAB in a drug, no, I don't want to bookmark this. It means monoclonal antibody. So we're manipulating the immune system with this drug. Then any of these drugs can end up having that dog develop antibodies to this drug, rendering them ineffective. And for many people, that may take years or months. For some dogs, it may take one injection and you got some help, but the next one, absolutely no effect whatsoever. It's incredibly variable and very personal. So this at least gives you what the company knows about and what's being talked about. So in terms of reactions, rare, 1 to 10 animals per 10,000, 1 to 10 animals per 10,000. Hypersensitivity, vomiting, diarrhea, neurological signs. These are short-term reactions. Very rare is injection site pain, swelling, immune-mediated diseases, IG, hemolytic anemia, IMTP, so platelet immune-mediated disease. But this doesn't, again, discuss the long-term effects. And then what else do we do? So this is where you end up at sites like this because that doesn't tell you much. And unless you find a specific FDA letter about this drug, you really don't have any idea that it isn't quite what the company said. Now, if I go back here, this is how far down the rabbit hole you have to go to get more information. So I think there was a letter somewhere which I cannot find, but you will find if you just adverse reactions of vet drugs, you will find some of these veterinarian letters. So it's really frustrating and difficult for the average person to figure this out. Okay, so what else do we have here? That's why, because it was on this one. So periodically, so what I did was search Apoquel side effects, FDA, and here is a letter from Dr. Dawn Cleaver, or to Dr. Dawn Cleaver from the FDA. So she is the regulatory veterinarian for Zoetis. And this is, interestingly, where is the date on this thing? Unless I'm blind, which I think maybe I am, but I don't see it. Anyway, dear Dr. Cleaver, the USDA has reviewed the website for Apoquel. So remember we were talking about the fact that walnuts, you can't discuss about the health benefits of food, and in specific walnuts and cherries, or you have a new drug classification. Guess what? That same law gets applied to these guys too. The website makes false or misleading representations about the risks associated with Apoquel. And below is the indication and summary of the most serious side effects and risks associated according to the FDA approved package insert. So Zoetis was trying to not include some of this. Dogs must be at least 12 months of age, right? Because we're using an immune regulatory thing. And then the PI warning contains so the package insert contains warning and precautions, yada, should not be used in dogs with serious infections, may increase susceptibility to infection, including Demodex, exacerbate cancer, neoplastic conditions, not for use in breeding dogs or pregnant lactating bitches, and not evaluated in combination with glucocorticoids, cyclosporine, or other systemic immunosuppressive agents. And 5, dogs receiving Apoquel should be monitored for the development of infections, including demodicosis and neoplasia. All right, so what did they do? The opening page on the Apoquel website contains the following statements with a link on the word safe. And basically, what they did was hide this stuff as much as they could, and the FDA called them on it. And then, so this is specifically that they were trying to uh, use a very short-term study to substantiate the product being safe, and that the side effects were similar to placebo, with many of the side effects associated with the use of steroids. And so they go through this, but they misrepresented what the study said, right? So this is the interesting thing. If you dig, and it really stinks, because you do have to dig to get this information. Okay, that is not cool, but it is. And so this is where you have to really start to look at, okay, how do I even evaluate these drugs? If there is a drug being sold to you by your veterinarian, it is FDA approved for what that's all worth. So I'm going to just drop you these links so you can go through and see the thought process I'm using to figure out what's a good choice, what's not a good choice. And you'll also have access to this NOAA compendium, so you can at least start with the drug insert or package insert. Okay, Dr. Ruth, that is so boring, but it is really critical. And what I would encourage you to do is to realize that you, for all of the other searches you're going to do on these drugs, you need to take them with a grain of salt, right? Because they're gonna there are all these groups that are convinced that Apoquel killed their dogs, and for many of them, they did make them more sick. But what they're not able to separate out is, okay, my dog wasn't feeling really great anyway, and it was tearing itself to shreds, and we started the dog on this medication, and then X, Y, and Z happened. Now, did X, Y, and Z happen because the dog started on Apoquel or because the dog was already sick? And this is the difficulty. There's a lot of pushback from pet parents, and rightly so, on these drug companies because they're not being transparent and clear. Like right now, the whole Librela thing, um, Zoetis is like telling, "Oh, just ignore that letter from the FDA. It's completely safe. You don't have to worry about it." Which is like, really? Why are these guys not being sued into the ground? Because they pay a lot of money to get stuff through whatever governmental body, whether that's in the US and the FDA or EDIF or whatever it is. Wherever you live, drug companies are paying to get their products through and to help support education of the regulators. Now, in the US, they have a great deal more influence than they do in other countries, but still, it's a problem everywhere. So, what do you do? Go do your research. Start with the FDA, start with the drug package insert for the medication, and read that. So, if we want to look up something like package insert, let's see if I can do this. Come back to this screen. We can type in package insert Apoquel. Except for I can't type, but I think it gets it. All right, here it is on Zoetis' website because they are required to do this. Now, this is 2 pages of extremely fine print, but this is the place to start because it's going to tell you what the drug manufacturer is required to say. And as things go on, they will have to add things based on field experience. And so here you see this. So here's the continuation field. So 239 dogs, right? That's how many dogs it took to get this product on the market. And then post-approval experience in 2020. Here's the things that could show up. And remember, it's not always possible to establish a causal relationship to product following these events. Now, the difficulty is that there's things that happen, and we think, and I'm guilty of this, having been in practice, that, oh, yeah, that probably was from the drug, or oh, that was probably a vaccine reaction. But we don't file that complaint. We don't register that adverse reaction. And so what happens is these are much, much lower than the actual adverse events. So bear that in mind too. Okay. All right. What are we going to do? Part of this is to help you understand that you have options for supporting your pet with allergies. And the thing is that we can wait until the dog is scratching its skin raw, or we can know, for most of us that have had pets with allergies, that it's going to be a problem and actually start prepping back in November, ideally. But if it didn't quite get there, here's where we can go now. What do we know about allergies? We know that they are often related to dysbiosis or leaky gut. So, if we started working on leaky gut by doing things like food sensitivity testing and then creating diets that don't include ingredients that our pets probably are sensitive to, we can start to calm things down naturally. And then the other part is healing that leaky gut. So, whether that's using supplements to help heal and seal the gut, like digesties, and then probiotic organisms. So, preparing the gut to heal with Saccharomyces boulardii. There's just a myriad of things that you can do. And we got the peeps in the crowd that can help you. I know Sandy's on here, one of our trained holistic pet health coaches. So that's the thing, is that this can sound daunting, but you have help available to you. And that is in the form of holistic pet health coaches that have trained and are certified to help support you through understanding that process of healing and sealing the gut. There's Melissa, there's Karin. So we got the peeps in the crowd. Thank you, ladies. This is not news to you, but you know how to support folks that are having these issues. So ideally, it's February. If your pollen season starts in March, you still have 4 to 6 weeks to start to get some things on board. So work on the diet, get some things on hand that are going to help support symptomatology. And so one of the supplements we love is quercetin and stinging nettles, which are natural histamine controllers. And so if you're not familiar with this, they are super awesome because you will start to see reduction of circulating levels of histamine generally within 48 to 72 hours, and sometimes as quick as 12 hours. So there is that. So work on the gut, get some things to help reduce the inflammation and discomfort. Omega-3 fatty acids are another tool you can use that is super, super important in terms of improving the level of inflammation in the body. And guess what allergies do in the skin? They create inflammation, redness, swelling, and omega-3 fatty acids help drop that. The so we've and I've got some cool stuff coming up on that too, but I won't digress too far. And then lastly, if you know your pet's going to have some allergy issues, we do have a bundle of omega-3 fatty acids and histopause, the quercetin and nettles, so you get a little discount on it. Yep, and right on. So Penny's asking, and this is a great question, what are the dosage? What are the markers for dosage? So we start with a suggested dosage for, say, a 10-pound dog, maybe 50 milligrams twice a day. If they are itching like mad, you may use that 50 milligrams 4 times a day, or 50 milligrams may turn into 100 milligrams 4 times a day. So you can use this at a much higher dose in the short term to help control the symptoms. So, for instance, when I was still living in Charleston, South Carolina, high humidity, I was taking 1600 milligrams 4 times a day. Now, there's some discussion about, whoa, that could hurt the kidneys. It turns out that the study that said, oh, quercetin causes kidney damage was 900 milligrams given intravenously, and it was transient. So, in terms of quercetin in kidneys, it actually improves kidney function by reducing the deposition of advanced glycation end products, AGEs, those aging molecules at the basement membrane of the kidney. So, it actually may improve kidney function and kidney values, which is what we are really after, something, an amazing antioxidant that does amazing things everywhere. The other thing that is interesting is that many IBS, IBD symptoms get worse around the time of spring allergies because the gut and the skin are related. They're ingesting, literally licking off all the pollen on their feet, on their coats, et cetera, et cetera. That's going in the GI tract, and they're having another reaction to this pollen in the GI tract as well. So there's supplements, and we want to use things that help reduce this discomfort, but super simple things like washing their feet off before they come inside, wiping them down with a damp washcloth, bathing more frequently. And it doesn't necessarily have to be with soap, but literally just hosing the garbage off their skin. Those can all improve how these guys respond. Another herb that we need to start looking at with our pets is holy basil, because it can reduce histaminic reactions in the gut and help improve function. So just watch for some news on that. But this would be another thing to consider. And then heal the gut, heal the gut, heal the gut. It may not be completely possible once we're in that allergy season, but you can certainly work to make sure that it doesn't get worse. So in the Southeast and South Carolina, in March, we joked about the yellow snow because the pine pollen was that thick. It was just disgusting. If you had allergies or you don't have allergies, that's enough garbage in the air to make your sinuses go on fire because you're just breathing this stuff in. And so I think over time, what happens as well is that people don't have allergies, but due to the intensity of that exposure, we see many people and animals develop allergies over time. So cool. So that is really cool stuff. I wanted to just do this really quick to help you start to think about things. And the other thing, the other component of this is if you've had to use those drugs. And here's the other thing I want to say to you. If your dog is scratching itself to the point where it is bleeding, it is raw, it's getting infections, nobody wants to use these drugs long term, but if you need some short-term relief, you need some short-term relief to keep the dog from destroying itself and from suffering. I'd love to say that we can solve everything naturally, but there are some dogs that are, and people and cats that are so far down that path of whatever that process is that we need pharmaceuticals sometimes. The goal is to limit, reduce, and hopefully remove the pharmaceuticals from the game plan. And this can be done. Almost every one of our coaches has had the experience of helping a pet parent wean their dog off of Apoquel, off of Cytopoint. And did that take 3 weeks? No, it didn't. Some cases 6 months, 8 months, a year. But keeping that in target in sight of this is my goal is to get these guys off of these drugs if we can by helping their immune systems function normally because we're restoring normal gut function. And now the skin, which is an epithelial cell like the intestinal cells, are no longer being attacked by an immune system. Right on? So this is the deal, is that in the Southeast, especially if they have horrible allergies, sometimes you need these prescription medications. to just prevent this dog from annihilating itself. And it's not as severe in cats, but we do see it with kitties as well. Support from your veterinarian, support from your holistic pet health coach, and then go down the systems of function, improving digestion and assimilation of foods, improving the function and the quality of the microbiome, reducing inflammation. And here's the last part I want to talk to you about is improving detoxification. All right, your dogs needed some Cytopoint or Apoquel or prednisone or cyclosporine or whatever it is. It needed some antibiotics and steroids because it had a skin infection that was really creating some significant health issues and making the dog and the family miserable. Okay, now what do we do? All right, we're getting things better, things are better, but we've used drugs that manipulate the immune system and drugs that have long term effects. So, for instance, the anti itch effect of prednisone is somewhere on the order of, depending on what type you're using, 3 to 5 days to maybe 2 weeks for a repository. The impact on the endocrine system is 12 weeks. Wow. Okay. So we need to help the body get rid of this stuff, get rid of those metabolites that are suppressing normal immune function. So, how do we do that? One is what we're already doing. We're improving the gut. The gut should be the lung, and then the gut should be the second detox organ, and then the liver. But because our animals and we are so dysbiotic and have leaky gut, often the liver is the primary detox organ and it cannot handle the load, right? So there's a couple of things we can look at. And one is using some sort of a binder. So fulvic acid, and that's right, Sandy. It's not as hard as it sounds, but I'm just giving you the quick fire hose method. And this is why you need to work with holistic pet health coaches because they will take a breath and actually let you ask questions and be able to explain this not in doctor talk. Anyway, so back to detox. Fulvic acid, humic acid. Fulvic acid can go intracellular, take nutrients in, drop them off, grab the evil spirits, suck them out. In cell core products, that's carboxy. We also will use TUDCA, so toro ursodesoxycholic acid, similar to ursodiol, which is a prescription medication. But the goal with TUDCA is that it gets stuff into the cell and it helps to get rid of waste products. Glutathione. Super, super cool shelf-stable glutathione product is coming, but it's gonna be a few months. But in the meantime, liposomal glutathione, master antioxidant for the liver, super awesome, tastes dreadful. Refrigerated product, so it's a pain to use, but it is incredibly effective, especially if you know your pet's been exposed to something. It was on pred. Okay, let's use some liposomal glutathione to help the body get things under control. The gut program we were talking about earlier, and plain old milk thistle is an amazing thing in terms of supporting liver function until the gut comes back online. High fiber, high veggies. If you're a raw feeder, if you're not using Gussie's gut, you need to be. Girl, get some veggies in your pup's gut. And it also contains superfoods that are going to accentuate and accelerate the liver's ability to detoxify. Now, if you are open to this, and my solution is home cooking, because we're going to provide healthy animal proteins, healthy fats, healthy vegetables, and lots of fiber to actually give the probiotic organisms what they need to thrive and survive, plus all the amazing polyphenols that come with the veggies. Feed the rainbow, we're feeding the microbiome. The polyphenols are not for us, it's for them. Okay, that was like super fire hose. What else do I need to say? So, if you want our detox protocol, Melissa, I'm not sure how you can help this out, but just type in here detox protocol. Exciting news. We are bringing the products I just mentioned to the website. So, the carboxy, TUDCA, and a couple of other tricks from Cellcore. They will be behind a login screen. So, meaning you can see them on the website, but you do need to create an account with us in order to purchase them. But we will have a protocol so that you know exactly how to use them, where to start, and where to get going. I think that's it. Okay. Any questions, you guys? Are your heads swimming? Are your eyes blowing up? Right on, Lisa. So we'll get you that. And then we also have an allergy protocol. So we will figure out how to do this. I threw this on my team at the last minute, but I think this will be super duper useful for you. Um, the other thing is too, we have a massive Facebook group of 56,000. I don't know. It's crazy. We also have a very private group on our platform called Circle. So this is where we've talked about doing this, how to work through this. I think this is actually a link to where this will show up in Circle. You can get more questions answered there from the coaches because they'll be monitoring this. And yeah, 57,000 people in Facebook. So that's another place where you can get great support. But because it's Facebook, we have to be cautious what we discuss. And the group is for you, the pet parent, to ask questions of the holistic pet health coaches so that you can get some information that's literally been vetted by me. I trained them, and they're also able to give you their spin and their take on how they've dealt with it in their pets and their clients' pets. Okay, amazing. Happy Thursday or Wednesday. I hope you all are great. We are super excited that you showed up. We'll be back next week, I think, with a coach. And right on, Karin. Actually, we're talking tomorrow about some detox stuff as well. So come check that out as well. And this is the deal, is that if this is something has been going on for a long time, it's not going to take 2 or 3 days or 3 weeks or 6 weeks. This is a long-term process. But what you're going to see is incremental changes so that you get to that end goal. So keep that in sight and also journal for your guys. If you're dealing with a dog that has 27 things going south, it's hard to know what's what unless you're keeping a journal and you're like, oh, okay, actually the itchy paws are getting better. And that's photos along with written journaling is going to be critical for you to remember where you started from and where you're going. Okay, that's it. Have a wonderful day. Talk soon.